wanted to ask Peggy one last question that's a little off the track where we've been here about media dynamics, and specifically how you think the rise in social media has affected these debates, and has it changed the way that you report on pricing and other issues?
An interesting part of this, I think, that though is are some of the very active players that are getting their story out. They're telling their story through what used to be non-traditional avenues outside of social media, but things like people who are blogging actively on something and who are developing a following that way. They're not calling up the Wall Street Journal or the New York Times or even MedPage Today. They're creating their own story and they're posting it on their own blog, and they're driving a community to that. And then eventually it becomes picked up by other media. But a lot of the things that develop into stories come to us that way, from that realm as well. So yes, so there has been an influence. We haven't had like a pharmaceutical spring yet that's come to us via Twitter, and I don't know that we will. But I think that definitely has had an influence.
You can drive a lot of conversation through social media and content that the industry has done a good job with and can continue to do a better job with engaging that discussion.
I think it's truly transformative. We've got new tools in the toolbox today that people would have considered science fiction 10 years ago. I mean, it's truly transformative, and I think we tend to not get out there as much and engage in those conversations in the way that needs to be. I hear from my friends in the media all the time. They would love to be able to have more of these conversations, and I think we need to be out there more to have that conversation, to talk about it, to engage, and to be willing to take the tough questions.